Hey!
Welcome back to Hello on 2 on a wonderful Wednesday. Still with Constantine and Annie. And yeah, if you're having your lunch at this moment, we'll have a double take.
Have double for us.
Yeah.
Think of us and have extras. All right, of course it has to be, healthy lunch.
Exactly. And speaking of healthy, every Wednesday we feature, Doc in the house.
Yeah.
And this time around we have Dr. Leong Chi Lun. Welcome to the studio.
Thanks.
All right. He's the specialist consultant of infectious disease from Sungai Buloh Hospital. And this time around we're going to be talking about TB, or what's the medical terminology for it again? It's
tuberculosis, pulmonary tuberculosis.
We got pulmonary tuberculosis and also extrapulmonary tuberculosis.
See, there we go. See, it's only the doctor who would know the exact terms.
Okay, but let's get to the basic. What is TB?
TB is mainly caused by the germs Mycobacterium tuberculosis. It's actually an airborne disease that actually is spread through air, and when we inhale, it initially go to our lung. But when it also can disseminate to other organs, and we are seeing more and more patients with TB, extrapulmonary TB also nowadays.
In Malaysia, so it's very prevalent then?
Yeah, especially immunocompromised patients. The risk factor for having tuberculosis now is majority HIV infected patients, not only HIV infection but diabetes, end-stage renal disease patient, any patient who has immunocompromised by any sort like SLE or any chemotherapy, all immunocompromised patients were more prone to get tuberculosis.
Okay, now doctor, hold on before we ask the questions. To all of you out there, if you would like to give a call to the doctor, ask a few questions to us, or just say hi to the two of us, 2282-8578, 2282-8579. Give us a call. Email, of course, is open, and send us an email, or you can give us a shout out on the Facebook. Bug us anytime you want, and we'll get the question going to the doctor.
Now, doctor, I'm really curious. What are the symptoms of TB?
A lot of people thinking when talk about symptom of TB, a lot of people will be very thinking about coughing, prolonged coughing, cough out blood. In medical term we call hemoptysis. Lost weight, loss of appetite, prolonged fever. But sometimes tuberculosis can also manifest extrapulmonary, means other ways that we got enlargement of the lymph nodes. Sometimes chronic diarrhea with gut TB, and sometimes can also be neurological symptoms if there is brain TB. So there are many organs can be affected by TB, and it makes tuberculosis now quite difficult to diagnose.
Okay, can it be a combination? I mean, is it possible to have like a combination of all those that you just mentioned at once?
We call it disseminated tuberculosis. It affect all other organs.
Okay, now doctor, let's break this down a little bit for the viewers out there. Again, this is something that I read, and I would like to ask you this. One, you get cough, dry cough, and all sorts of cough. There's an infection, the tuberculosis infection that you get, but then you don't get the full-blown disease. So is there a possibility that you can actually stop the whole thing at the infection and actually cure it at that level before it goes off into a full-blown disease? Is that something that's possible? Or did I read it wrong on the internet?
It is possible, but you need to be careful on that, because what you are talking about, a patient get infection but not full-blown disease yet.
That's right.
Yeah, that is something we call latent TB, go up to the. We need to be careful that the patient is not having full-blown TB before we treat as such.
I see.
Because if you the treatment for latent TB is not really recommended for all in Malaysia in our setting now.
Okay.
Yeah.
So when we talk about Malaysia, I mean, I'm not going to ask you about statistics of people coming in with TB, but how often, in your case, do you treat people who come in with TB? And what's the age range right now when you treat them?
It happens every age now.
Okay.
Every age, both genders?
Both genders.
Oh, wow.
It doesn't see which genders.
So how young is a young patient coming in?
From pediatric up to elderly.
From pediatrics?
Yeah.
Why
We're talking about baby here?
Yeah,
but I am not seeing pediatric patients, I'm seeing adult patients.
I see.
Right.
Yeah.
I'm a bit curious, because how does that affect the child actually?
It's an airborne disease, so it happens every age group, everywhere.
Right, okay.
I understand that when you don't realize that you caught TB, but it does stay active in your body before it starts showing symptoms. It could also happen after many years and just come out.
Yeah, because when you get infected, your own immune system sometimes can fight against it and it get healed in the lung, and we got calcified lesion in the lung, but it doesn't go to full blown if your immune system is good. But if your immune system get lower, it manifests as full blown tuberculosis later.
Oh, okay.
Like later after, maybe, for example, 2 or 3 years later, it comes out. I see, I see.
All right. Well, Doctor, we're going to take a quick break because we have more questions coming your way. For you out there, I'm quite sure you may have a couple of questions coming in. So 2282-8578, 2282-8579. Give us a call. Quick breaker coming your way. Hot flavors, of course, it's medical topic, but hey, it's lunch hour, so we thought we'd share some flavors with you. Take it away and check this out.
And welcome back. You're watching Hello on 2, and we continue on speaking to Dr. Leong. We're talking about tuberculosis, and let's jump straight into this question. How is TB disease treated, and what type of drugs are used to treat it, and are there any side effects?
Treatment of TB has been same all the while. We divide into active induction phase of treatment and also maintenance phase.
Right.
During the active phase of treatment, usually we give four drugs: isoniazid, rifampicin, pyrazinamide, and intambutal.
Oh wow!
For 2 months. And then maintenance, we just maintain with isoniazid and rifampicin for another 4 months.
Okay.
This is for pulmonary TB, and extra pulmonary TB such as TB of the brain or bone, spine. Sometimes that kind of TB, we need longer maintenance duration. We can treat up to 1 year.
Okay, Doctor, hold on a minute. We actually have a caller online. Daphne, hi, good afternoon.
Good afternoon, everybody.
Hi.
Okay, can I pose 2 questions?
Yes, go ahead.
Doctor, especially to you.
Yes.
Usually, during our babyhood, 3 injections are given to us, right? Inclusive of the TB injection.
Right.
How long does this last, and why should TB again be?
Why does it come back?
Why does it come back?
Right.
Number 2 is, what are the very early signs of TB?
Okay.
And being we have the best specialists, we have the best medicine in Malaysia, how come this cannot be cured indefinitely?
You just asked the question we wanted to ask. Thank you, Daphne.
Thank you, Daphne.
All right, so basically her 2 questions. One, what's the earliest symptoms of a TB? The other question, of course, she wanted to find out about, what is it that causes the whole thing? And why does it come back?
The earliest TB can be earlier symptom, usually prolonged fever, lost weight, lost appetite. That's the earliest symptom. Later we have cough and then start swelling elsewhere. So earlier symptoms can be quite subtle. This is mainly for pulmonary TB. It depends where the organ system it started off. So, the second question,
she wanted to know what is for babies who are given the TB injection, why does it recur? Will it recur, and if so, why does it recur?
The babies giving vaccination, the BCG, it doesn't really it is actually it's not lifelong.
Right. Okay, so they still need to go in for treatment or checkup as well. Which is why you have actually babies who are affected as well for TB. Let's just go back to in terms of the drugs itself. Now, we were earlier on talking about the side effects. In your opinion, doctor, again, I always go into looking at alternative medicine. I think a lot of people out there would love to look at alternative medicine. Is that something that people should look into? Alternative medicine versus your Western medication?
I will say if you take alternative medication, it make more complicated because the TB talking about side effect of TB medication first. The TB medication very common can cause allergic rash reaction, and rifampicin and a lot of these TB drugs also can cause hepatitis. So if you take alternative medication, that will also affect the liver. So if you are taking alternative medication together with our TB medication, if you have hepatitis or side effect, we were not sure which one to blame on then.
So it's best to either go for Western medication or then just go straight for alternative. Don't mix the two. Okay. Now, Malaysia, again, 2282-8578, 2282-8579. phone numbers open, emails are open. In fact, our Facebook is open. Give us a quick shout out if you do have a question for the doctor about tuberculosis. That's the topic that we're going hot on right now.
Doctor, would you recommend these patients, okay, with TB to be quarantined? Or should they stay at home? If they have TB, are they allowed to go to the office?
Okay, actually TB is quite easily treatable.
Okay.
If you are compliant with the medication, it doesn't really need quarantine, because if the person having TB, you need support from family member. If the patient, or if what is important is for the family member to be screened for TB, because they probably already transmitted to the family member even before they start treatment.
Oh dear.
So it's important to screen all household that together with this patient, whether they has TB or not, and if they are having early sign and symptoms, they need to be treated as well.
Right.
So we need family support and all that. And when the patient develops side effect, even more that the patient needs support and from the family member to be compliant to the treatment with the medication.
All right. Now let's talk about a very quick advice that you can give to our viewers out there. You know, if we do, as we notice, we do have a lot of viewers who watch us this afternoon. What is it one advice you'd give for the viewers about tuberculosis?
We need to seek medical attention if you have any early symptom of TB. The other advice, a more tough thing is you have extrapulmonary TB. Sometimes you really, what I see whenever I ask patients to get for more invasive procedure to biopsy the bone or whatever,
they are scared about
or the
invasive
lymph nodes,
procedures.
they are very scared of invasive procedure.
Right.
And you really need to take risk sometime to get the diagnosis fast and then get treatment fast, and also to give us as a doctors, we are more confident on treating you as TB rather than guessing, and then when you develop side effect, then it make all of us not sure whether should continue the TB treatment or not.
Okay.
So sometimes cooperation, understanding between doctors and patient relation, get the diagnosis fast,
important.
and then after that, if you confirm the diagnosis, to stick to the medication, adhere to the medication until you complete treatment.
All right, brilliant, brilliant. Thank you, Doctor. Thank you very much for joining us this afternoon. And yes, that was Dr. Leong Chi Lun, who is a specialist consultant for infectious disease, Sungai Buloh Hospital. Once again, thank you very much for joining us this afternoon.